second hat. But I don't want to waste my time, so if anybody is interested, please ask me at the end how that happened. But I am here tonight representing PlettAid, an organization that works in South Africa in a district which is called the Eden District. And I don't know how many of you know South Africa, but the Eden District is a particularly beautiful tourist and biodiversity hotspot. It's also an area that has been growing hugely in its population over the last 10 years. And I think about 70% increase, of which 75% are really poor communities like this one. Kwanakutula, which is where PlettAid is based, which has grown by about 75%, with people really looking for work and for a future. And it's here that PlettAid works. We are a health promotion organization who provides services to poor people in terms of their health care. We work in all the different poor communities across this region, which is about 900 square kilometers. And really our purpose is to uplift the quality of life for the communities of this bitter region, to provide health care for all who need it, and to provide dignity and death for the terminally ill. And a key part of that, of course, is caring for children. I don't know how many of you are parents here tonight. Some. So obviously for us, parents who are dying are most affected by what's going to happen to their children. And really what we do is provide support for that, and that's what we're here to ask you for your support for tonight. PlettAid meets the Sustainable Development Goal number 3, which is to ensure health for all. And we run 2 programs. The first is a wellness program, which is obviously health promotion. It's an illness prevention strategy, and it is the root of how countries and nations are going in terms of healthcare. But of course, the other side of that is a palliative care hospice service for terminally ill. And I think one of the problems with the unintended consequences with sustainable development is if you focus on health promotion, what happens to those who are already ill? And you can see here what has happened since the South African government has changed the healthcare focus from a health promotion, or to a health promotion one at the end of 2014. So we've seen about a 200% increase in demand for service for people who are living with terminal illnesses of various natures. And that really results in a significant need for care. And so we work with home-based carers who come, this clicker, sorry, it's not working brilliantly, who come from the communities. We have home-based carers who are trained. They are culturally matched in the communities, and that actually is really important for increasing trust and increasing treatment compliance, that actually there are people from the community, for the community, who are caring for individuals. And it also opens up, I think, a whole level of trust in what will happen to the children, which is key. The work we do doesn't only cover, obviously we have home-based carers. You can see Zenzel on the far side, and Edward, who is a professional nurse. So we have professional nurses, professional social workers, who are all supported by carers who provide daily visits to homes across the communities. We also provide support even for children who are affected. So Luigi here, who was sadly knocked down by a truck, who is left with brain damage. And our focus is not only on the healthcare needs, our focus is also on everything that is related to that. So for example, Luigi couldn't get out of his house. He has a wheelchair now that his mother has to use. And so really what PlettAid does is look at what are the modifications, what are the other related requirements for healthcare that are needed. We also provide support for the families of patients. Here is Edward with a little baby, grandson of a patient. And here is obviously siblings who were affected by diabetes. The baby, the granny, the dog are all part of PlettAid's care regime. Sorry. So what are we really speaking to you for tonight? We're actually speaking about the need for children who are left behind, who need government grants and support. Sorry, I'm really battling with this. And who need to have actually financial, legal, medical support, counselling. So this is looking at the last year of interventions, the kind of interventions we do on behalf of children. Food parcels, sorting out their shelters, giving them extra lessons at school when they're struggling, giving them play therapy, all of this kind of work, which is part of the home-based care, which is part of making sure those children can actually get through the loss, get into a future, be fostered, or be cared for by a significant adult. So what will £6,000 do for us? Well, it will help us support at least 20 children for between 3 and 6 months, and that will provide home care assistance, counselling, continued school attendance, extra lessons where they're needed. Importantly, it will provide the financial and legal aid that they need. Many of these communities have low literacy levels, so that is an important part. And if we raise more, even if it is £5 more, it's another therapy session. It's another month of feeding. So it would be great if you could support and give tonight. Thanks.